The Black Death, bubonic plague. The Black Death was one of the most devastating pandemics in human history, killing up to 200 million people in the 14th century. Caused by the bacterium Yersinia pestis, it was primarily spread through fleas on rats. Symptoms included swollen lymph nodes, fever, and blackened skin due to tissue death. Without antibiotics, this disease had an extremely high fatality rate, often killing its victims within days. Today, while the plague still exists, it is treatable with modern medicine. Improved sanitation and pest control have also played a crucial role in reducing outbreaks. Smallpox. Smallpox was one of the deadliest viruses ever to exist, responsible for an estimated 300 to 500 million deaths in the 20th century alone. It was caused by the variola virus and spread through respiratory droplets. Victims suffered from high fever, painful sores, and widespread scarring. The virus was extremely contagious, spreading rapidly in densely populated areas. Unlike many other diseases, smallpox was eradicated in 1980 through an aggressive global vaccination campaign, making it one of the greatest triumphs in medical history. Spanish flu. 1918 influenza pandemic. The Spanish flu, 1918 flu pandemic was caused by the H1N1 influenza virus and killed between 50 to 100 million people worldwide. Unlike typical flu strains, this virus disproportionately affected young and healthy adults, causing their immune systems to go into overdrive. Victims developed severe pneumonia, and many died within hours or days due to fluid buildup in their lungs. The lack of modern antiviral treatments at the time made the situation even worse. The pandemic highlighted the importance of public health measures such as quarantine, hygiene, and vaccination. HIV/AIDS. Since its discovery in the early 1980s, HIV/AIDS has killed over 40 million people. The virus attacks the immune system, making the body vulnerable to other infections. It spreads through unprotected sex, contaminated needles, and from mother to child during childbirth. Although there is no cure, antiretroviral therapy, ART, allows people with HIV to live long and healthy lives. However, in regions with limited access to treatment, the disease remains a leading cause of death. Awareness campaigns, preventive measures, and medical advancements have significantly improved life expectancy and quality of life for those living with HIV. Ebola is a highly fatal virus with some strains having a mortality rate of up to 90%. The virus spreads through direct contact with the bodily fluids of infected individuals. Symptoms start as fever and weakness, progressing to internal bleeding and organ failure. Outbreaks have mainly occurred in Africa, and while there is no universal cure, supportive care and recent vaccine developments have helped control its spread. Containment measures, such as isolation and contact tracing, are crucial in preventing further transmission during outbreaks. Malaria, caused by Plasmodium parasites and transmitted by mosquito bites, has killed millions over centuries. It leads to fever, chills, and severe organ damage if untreated. While not always fatal, malaria remains one of the deadliest infectious diseases, particularly in Africa. Prevention through mosquito control, bed nets, and medications has helped reduce mortality rates significantly. New vaccine developments and genetic modifications of mosquitoes offer hope for a future with reduced malaria transmission. Tuberculosis, TB. Tuberculosis is an airborne bacterial infection caused by Mycobacterium tuberculosis. It primarily affects the lungs and kills nearly 1.5 million people annually. TB symptoms include chronic cough, weight loss, and fever. Drug-resistant TB strains pose a major health threat, making treatment difficult. However, antibiotics and vaccines like BCG have helped in prevention and treatment. Efforts to improve early detection and access to effective treatments remain essential in controlling the disease globally. COVID-19. The COVID-19 pandemic, caused by the SARS-CoV-2 virus, emerged in late 2019 and quickly spread worldwide. With millions of deaths recorded, it became one of the deadliest modern pandemics. Symptoms range from mild respiratory illness to severe pneumonia and organ failure. The rapid development of vaccines and antiviral treatments has helped reduce mortality rates, but the virus continues to evolve. Global public health responses, including social distancing, mask mandates, and vaccination efforts, played a crucial role in limiting the spread of the virus.